Բարև ձեզ հարգելի բարեկամներ, Սփյուռքի ձայնը հեռուստահանդեսը դարձյալ ձեզ հետ է։ Այսօր կրկին մեր եթերը տրամադրում ենք հայ բժիշկներին։ Դոկտոր Օհան Կարատոպրակը շարունակում է իր հարցազրույցը հոգեբան բժիշկ Լուիս Նաջարյանի հետ։
Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. I'm Dr. Ohan Karatoprak. In last program, we talked about trauma and its effect on people, children, and adults. In this program, we'll be talking about resilience and recovery from the trauma. And my guest again, Dr. Louis Najarian, who is clinical professor at Hofstra North Shore LIJ Medical School and in clinical practice of psychiatry for children and adults. Dr. Najarian, welcome again.
Thank you.
So last program we talked about the trauma and its effect on children and adults, especially children we talked about. Now let's talk about the recovery and the resilience. What's the resilience?
Resilience is a word that comes from physics. It means when a matter is stressed, it maintains its same position. It doesn't change.
Right.
In psychology, it refers to when an individual is stressed with traumatic events, that they're able to maintain that same level of function and adaptation. So we want to look at what are those characteristics of resilience, and we did a long-term study in Armenia.
That was a study, important study that you did really in Armenia.
Yes,
Right.
yes. We studied, and what was significant is we were able to follow children 20 years, from the time they were 11 to the time they were 28 to 30. And we found many aspects. A good example of how everybody knows a resilient person is Captain Snellenberg was flying a plane out of LaGuardia with 168
Right.
passengers.
Right.
He lost his engine, and he couldn't get back to LaGuardia. He either could land in the Bronx, killing more people, or land in the Hudson River. He was resilient. He didn't get panicky. He was able to keep his cool, and he landed that plane, and nobody was injured.
He was experienced because probably he had practiced this before.
Yes, that's a good point.
Yes.
When a person is traumatized in little bits and doses, and they've learned how to overcome trauma, they can handle new trauma.
Right,
That's
so
one
there's an
example.
experience for them.
They have practice at it.
Right.
And that's one thing that predicts a good response. Some of the characteristics of the resilience that we identified is education. The one most important characteristic is a connection to a stable caregiver in their lives. In Armenia, it could have been a dadi, it could have been a mother, it could have been an aunt. In the United States, it's usually a mother, not a nanny.
Right.
The mother or the grandmother is somebody that the child can relate to. So a stable figure is one important characteristic. But others are education. We found that it's important to have a hobby. So if children and adults have hobbies where they can find areas to feel good and to master. One significant aspect in Armenia that we found, all of our patients who were resilient, who did not have PTSD,
Right.
then and 20 years later, all went to church.
So
This
church
was in
is
a
important.
this was in a communist time.
Right.
They were all religious. They were all went to church. Things parents can do, what we said earlier, is remain together to clarify doubts and confusion. You can teach them how to see the positive side of things. One example of a teenage young man, his father died from a drug overdose. He was active and positive. In school, he started a program of children against bad decisions, for children not to use drugs because he had a bad experience in his life. Another important part of what parents can do is help children to have what we call cognitive flexibility. What does that mean? Well, it means that you can look at something in a different way. You can talk to children about, is there another way we can think about this? Something bad happened. How else can we understand this? The hurricane gave many examples. Teenagers could help. Teenagers could help with the cleanup. They could help with boarding up the windows. They could help with cleaning the mess. Teenagers have a lot of energy. It's important to use that energy and encourage.
And
These are
plus doing
examples.
something useful.
These are examples of resilience, turning something passive into active that's constructive. Another important aspect with particularly teenagers is to go by the rules at home and in school. It's okay to be a little flexible with bedtime, where they sleep,
Right.
but they have to be adhered to the rules. They have to maintain their curfew. They should be advised and told. They have to be told, we understand, not to have bad decisions, not to drink, not to drive dangerously, not to get involved in reckless activity. That's not the way to help. Let's get involved with the community. Let's help the blood drive. Let's help the school. Let's help younger children. These are some of the things parents could do. In the classroom, teachers could do the same. Maintain the routine, not be so strict with the homework, to give the children a time to talk about the hurricane. One thing we did in Armenia is we had a comic book about the earthquake. We taught children what was an earthquake, how did it happen. They learned about the tectonic plates. In Long Island, children are starting to become little weathermen. They're learning about the weather.
The weather, right.
And then there was a nor'easter 6 weeks later.
They knew what to do.
They knew what to do. So it's preparing them. This is resilience, preparing them for the disaster.
Positive way and resilient way.
That's what I mean by positive affectivity. There's going to be more disasters. We can't predict the next hurricane or the next snowstorm, but we can be ready. Some other things one can do. A mentor. It's helpful for adults to have a mentor, somebody to talk to. It's helpful for the children, not only their parents, a teacher, a coach. Growing up, I had a coach that I could go to, an uncle. Humor. It's good to be able to laugh, even the worst of times.
There are issues that with the children, let's say, that in the resilience, they can be overconfident and it can be a little negative. Let's talk about that too. It shouldn't be overconfidence or it can affect negative way otherwise, right? Resilience can go the other way too.
That gets back to the rules. The parents have to reinforce the idea of rules, and we have to follow the rules, and we have to be polite, and we have to be disciplined. Now, one aspect of post-traumatic growth is from the trauma, whether it's the hurricane or the shootings, they can begin to have what we call hardiness. What that means is we can have meaningful effect on life. That life has become more meaningful, we can influence others. We can have an impact on people around us. That life has more meaning, we become more spiritual, we step back and we appreciate what we have. This is another aspect of resilience that one can grow out of it. But the idea of being invulnerable, I can do anything, that particularly in adolescence, that could lead to destructive behavior, and parents and teachers have to be on the lookout for that. If they're talking too much about the weather, if they're talking too much about the shooting, they're talking too much about guns, from those videos we talked about in the last program, those are signals that you have to look more carefully and maybe call the counselor into school to have a session or two with that child. The other thing that is very helpful to teachers, when they see a child who may look sad, the teacher should say, "You look sad. Are you? Let's talk about it." To give that child the opportunity to express themselves. And the parents do the same thing, but not at bedtime. At time together, on the way to church on Sunday. When I spoke about this to a group, and there were a couple of priests in the audience, they were so pleased because spirituality, the community. Unfortunately, we Armenians have that extended holding community where children have to be accountable to not only their parents, to their teacher, to strangers at church or at the agump or wherever they are.
That's our Armenianism, in a way that it brings up that responsibility. I think probably it starts from home, and as you said, probably positive reinforcement from family and teaching and instructions properly, without scaring them probably, as you said, and in school the same way. So do you think that the parent-teaching organizations, when they get together, they should talk about this?
Oh, absolutely. As far as teachers and parents, as we said earlier, it's important if a youngster's having a particular difficulty, the parent should tell the teacher. If someone's getting a divorce and there's something else going on, the teacher should know that. If the teacher notices something in the classroom, the child's not doing as well, they're not paying attention as well, they're daydreaming, that the teacher should tell the parent that, so they may be able to look into that. But routine is very important at school and at home. And the parents, important that the parents and the teachers can show that they're nervous and worried, but that it's not the student's fault. But that connection, that cooperation between teacher and parent is extremely important to keep the children on mark and going forward, to tap into those resilient traits that they can be taught and they can learn. In AAHPO, in the metropolitan New York, New Jersey, Connecticut area, enough professionals, pediatricians, psychiatrists, psychologists that are available in addition to the schools for counseling. So fortunately we have this network, and I'm pleased to be able to speak to the AAHPO population for what they're able to do for the community as a public health service, but also as a practical matter of intervention.
Dr. Najarian, thank you for coming to our program. This was an enlightening program. Thank you very much. This is Dr. Karatoprak. Please visit AAHPO's website. See you next time. So long.